A bold claim that stirs debate. The Trump administration plans to link autism to prenatal Tylenol use. The Trump administration is gearing up to announce a controversial position connecting the use of acetaminophen, the main ingredient in Tylenol, during pregnancy to an increased risk of autism. This claim, expected to be revealed at a press conference later today, comes despite the fact that scientific research has not definitively established a causal relationship between the two. In a striking development, U.S. Secretary of Health and Human Services Robert F. Kennedy Jr. is spearheading this announcement, which follows a pattern of skepticism toward mainstream scientific consensus. Just recently, President Trump hinted at the significance of the upcoming news, calling it one of the biggest medical announcements in our country's history, and claimed, "I think we found an answer to autism." But here's where it gets controversial. This move is part of a broader trend in the administration of challenging established science, not only around autism, but also related to vaccines, abortion medications, and other widely used treatments. Critics argue this strategy risks undermining trusted scientific institutions and promoting a political agenda, while supporters see it as questioning the status quo. Autism, a developmental condition whose diagnosis rates have tripled over the last 20 years, has long been a focus for Kennedy Jr. Soon after taking office, he pledged to identify autism's cause quickly, even targeting suspected factors such as synthetic food dyes, vaccines, and common painkillers like acetaminophen. However, something important that many people miss is the lack of direct correlation between increased acetaminophen use and autism rates. While autism diagnoses have significantly risen, acetaminophen usage during pregnancy has remained relatively stable over the same period. Scientific consensus still favors genetics as the primary factor influencing autism risk. The disorder tends to run in families, and studies show that if one identical twin is diagnosed with autism, the other twin most often shares the diagnosis, highlighting the strong hereditary component. There have been a few small-scale studies suggesting a possible association between acetaminophen exposure in the womb and later risks of autism spectrum disorder, ASD, or attention deficit hyperactivity disorder, ADHD. Yet, the most comprehensive and largest study conducted, an NIH-funded collaboration between U.S. and Swedish researchers, found no evidence of increased risk from prenatal acetaminophen use. Moreover, even before this extensive study was published in 2024, a U.S. district court reviewed similar evidence during a product liability lawsuit and ruled without linking acetaminophen to autism. Medical groups like the Society for Maternal-Fetal Medicine continue to endorse acetaminophen as a safe and effective treatment for pain and fever in pregnancy. They stress the potential dangers of leaving conditions like fever untreated, which can lead to miscarriage, birth defects, or premature birth, especially in the early stages of pregnancy. In addition to discussing acetaminophen, the administration is expected to propose that leucovorin, also known as folinic acid, a form of vitamin B commonly used to counteract chemotherapy-induced deficiencies, might be an option for preventing or treating autism. This suggestion is based on research indicating many individuals with autism may have metabolic differences that reduce folate availability in the brain, and leucovorin could potentially bypass this metabolic issue. While leucovorin influences a crucial pathway for brain and nervous system development, and is occasionally prescribed off-label for autism, confirming its effectiveness remains a challenge due to limited scientific evidence. The Autism Science Foundation recently weighed in, acknowledging that some studies suggest low folate levels during pregnancy might increase autism risk. However, they cautioned that this area of research is still in early stages and emphasized the necessity for further, robust studies before drawing any firm conclusions. So what do you think? Is it wise to question established medical guidelines based on emerging but inconclusive evidence? Or should we stick to the science we know? This upcoming announcement is sure to ignite debate. Are we witnessing groundbreaking discoveries or politically motivated science at play? Share your thoughts and join the conversation below.